came back and he said that actually oral sex caused his cancer.
Right.
Did you hear about that?
That was kind of the gist, and that's pretty much the start and the finish to what I know.
Right. So there's a huge epidemic going on right now in America. And traditionally, cancers of the head and neck area, so the throat, the tongue, the tonsils, the back of the throat, those were cancers that mainly affected people who smoked and drank alcohol. And those were the main target of head and neck cancers. And people are smoking a lot less than they used to, so the incidence of head and neck cancers was falling. And right now, there's a new epidemic going on with a great rise in the incidence of head and neck cancer. And Michael Douglas was probably told by his doctors that he was part of that epidemic of an increase, mainly in men, of head and neck cancers that are affecting the oral pharynx, which is part of the mouth area. And actually, studies are going on right now that shows that there's a relationship between human papillomavirus. Have you heard about that?
HPV?
HPV.
Yep, sure.
So, do you know any other cancers that are related to HPV?
No, not particularly.
Cervix cancer in women, for example.
Okay. Makes sense.
So, right now there's a vaccine out, and there's a big controversy in young girls, teenagers, whether they should get the vaccine or not, because
I've heard that the vaccine is becoming much more common in young females.
Right. So I think there were several cases where parents got very angry at state regulations. I think Governor Perry, I believe, signed a bill because he felt that decreasing the rate of cervix cancer would be a public service. And, of course, many parents got upset because it supposed that their daughters were sexually active.
Right.
And so it was very controversial during the
sensitive subject
election. And now it turns out that men have a high rate of human papillomavirus, and especially men who get head and neck cancer.
Now, the male, he carries this virus, is that correct?
Yes.
But it's more effective in a negative light on the female. Is that correct? Or
no,
okay.
It's there's an association with females to get cervix cancer. Okay, and we talked about cervix cancer last week. We talked a little bit about it today, finding it early on to try to prevent its harmful or fatal effects. And women can get cervix cancer, and it's probably related mainly to human papillomavirus. And now there's another epidemic going out, and that's men with human papillomavirus and head and neck cancer. So what's important about it to know? Well, number one, it's important to know that it exists. It's also important to know that actually the men that get head and neck cancer from human papillomavirus have a higher chance of being cured. So rather than being an adverse effect and you're more likely to die, you're actually more likely to be cured. So it's a sign for our listeners to know if you've got something, you've got some pain in your mouth or bleeding or some lumps in your neck, see your doctor. You may well have something serious, but you may have something serious that can be very effectively treated. And I'm running around talking about this because there's a new study that looks at the spouses of men who have human papillomavirus and head and neck cancer. So what happens to the spouses? So presumably men get it from oral sex. Well, what happens to the spouses? And there was a study presented at ASCO, which is, again, the National Cancer Meeting for Medical Oncologists, and it looked at spouses of men who had human papillomavirus and cancer. And it looked at 147 patients with oral pharynx cancer and 83 spouses or partners. So most of the patients were male, and that's what studies have shown, that this is an epidemic in male. And specimens were obtained from a mouthwash. So it was very easy to get a mouthwash at the time and then a year later. And they were tested. There's 36 different types of human papilloma virus. And guess what the study showed? So what happens to the spouses or partners of men who have head and neck cancer caused by human papillomavirus? What do you think the likelihood of the woman, the wife, or the partner having human papillomavirus?
I would say it's quite high.
Yeah, well, it's just the opposite.
It is.
Yeah, it's just the opposite.
You corrected me.
The overall rate of human papillomavirus in spouses and partners was 7%. And if there was a physical exam done of the head and neck area of those women, none had cancer. So actually it was pretty good news for the partners or spouses of men who had head and neck cancer and human papillomavirus. What's the prevalence in normal women? If you take 100 women on the street, what do you think the rate of human papillomavirus in their throat would be?
I couldn't tell you. Let's go with 20%.
No, it's 4%.
4%, okay.
So actually...
So the 7 essentially gets cut in half.
Well, more or less, but actually statistical analysis has been done, and they compare the two groups, and there's actually no difference. Statistically, it's about the same.
Okay.
So it doesn't look like the man is giving his wife or partner human papillomavirus through the usual means, whatever that is. And so it's interesting that it seems like men are getting human papillomavirus spread to them, but they're not spreading it back to their wife or partners. So it's interesting, and it's probably a good social issue, because I imagine Mrs. Michael Douglas was probably out there worried, what's she going to do? Is she going to get it?
Yeah, sure.
And she probably fears that. So this kind of study is telling her that she can probably do all the things that any normal wife can do, and the likelihood of getting it or getting cancer from it seems pretty small.
Right.
So you can ask why, and we'll talk about that maybe next week.
Okay.
We don't have an answer this week, but hopefully there'll be some answers next week. And I had an interesting caller this week. A gentleman called with prostate cancer, and I just wanted to discuss him for a few minutes. Men who have prostate cancer have several risk factors. One is the blood test, which is the PSA, prostatic specific antigen. In most men, it's less than 4, and it goes higher than 4. It's a sign of cancer. Some doctors do biopsies when it's more than 2.5, but generally 4 is the accepted number. And I don't want to argue with anybody, but I can tell you that that's generally what's going on. But some people say if the PSA is going at a high rate, if it was 1 last year and it's 2.5 this year, maybe we should get a biopsy. But generally, PSA is one risk factor. And then when you get a biopsy and have cancer, there's something called the Gleason score. And Gleason was a pathologist, and he tried to tell us how aggressive a cancer would be by looking at the Gleason score. The Gleason score looks at 2 different areas of the prostate cancer and gives it a number from 1 to 5. So in one area, it's 1, let's say. In the other area, it's 1. 1 plus 1 equals 2, which is the best, theoretically, although it almost never occurs. And the worst is 5 plus 5 equals 10.
Right.
So this caller came in with a Gleason 7, and he was shopping around, he's calling around to see what kind of treatment he should have. And I told him that really he has to focus on this Gleason 7, because if he focuses on Gleason 6 or 5 cancers, or just cancers in general, he may get a misunderstanding of the prognosis. And most doctors will tell him that if you have a Gleason 7 or higher, you're at higher risk for having unsuccessful treatment. And so I just brought some data from probably the most famous cancer surgeon in America, who's in Baltimore. And if you have a Gleason 7 cancer and you go to a very famous cancer doctor, and he removes the whole prostate, what's your chance, do you think, of being cancer-free 5 years later? You have Gleason 7, you remove the whole prostate, you go to one of the most famous doctors in the world, and what's your chance?
Let's say 65%.
You are so smart. It's actually 66%.
Wow, look at that. Okay.
So you are right on.
Very good.
At this moment. But what about 10 years later? What about if you have a Gleason 7 and you go to this famous doctor, and 10 years later, what's your chance of being cancer-free 10 years later? Remember, he took out the whole cancer.
It's going to go 75%.
Well, remember, it was 66% at 5 years, so it's not going to be higher at 10 years, right? So it's actually down to 48%.
40, okay, so it does drop.
So what's interesting or worrisome is that if you have surgery for Gleason 7 cancer you're still having recurrences even 10 years later.
Wow.
So it's really important for the man to know about this and to take action to get better treatment. There's better treatment out there that has rates of success of 90% actually in our hands. So this gentleman, I was trying to emphasize that you can have a 50% increased chance of being cancer-free just by choosing the right treatment.
Gotcha.
I'm going to be closing off now, John, until next Saturday at 6:30. So please call us at 212-CHOICES, 212-CHOICES during the week if you have questions. Thank you, everyone, and have a great week.
Thank you, Dr. Lederman.
Thanks for tuning in to the Radiosurgery Hour with Dr. Gil Lederman and myself. If you have questions before next week's show, just contact Dr. Lederman at 212-CHOICES. That's 212-246-4237. That's 212-246-4237.